COVID-19 patients usually experience mild but can be severe respiratory illness symptoms. So most people experience a cough and fever. Some people may experience shortness of breath, while some patients may experience other symptoms including headache, muscle ache, sore throat, diarrhea, or even the loss of taste or smell. If you have COVID-19 symptoms, you should stay home for at least 7 days. It's important that your fever is gone for 3 days without the use of fever-reducing medicine, that would be like ibuprofen or Tylenol, before you leave the house as well. You should also see improvements in your other symptoms, like a cough should be getting better by the time you're leaving. If you have COVID-19 symptoms and you can manage those symptoms at home, you don't need to seek care at your doctor's office or get tested. However, if you're older or if you have underlying medical conditions, it's a good idea to contact your clinic and see if they have any specific guidance for you. You should be seeking medical care immediately if you're having shortness of breath or difficulty breathing. Other symptoms could include like turning bluish in your lips or face, persistent pain in your chest, something like that. Those would be reasons to seek emergent medical care. Now, testing guidelines here in Minnesota are changing as we expand our capacity. So you can visit that website on your screen for the most recent testing guidance. The CDC has a tool on their website called the Coronavirus Self-Checker, and that can help you make decisions about whether or not to seek medical care. It's available online at that address on your screen. If you are caring for someone at home who has symptoms, there's a few things to keep in mind. One is you want to make sure that that person is getting lots of fluids, drinking lots of water, and getting rest. Second, you want to make sure that that person is as isolated as possible. So ideally, they're in their own space, sleeping in their own space, and maybe even their own bathroom if that's a possibility. However, that's not always possible for everybody, and we understand that, and there's a few things you can do to help prevent the spread of germs in that situation, or even if they're in their own space. Thinking about using a face covering if that person is able to wear something, and if they're not able to wear something on their face, make sure everyone else does instead. It's also important to clean the house carefully and making sure you're cleaning the areas of high touch. So that would be doorknobs, countertops, phones, things that are frequently touched by lots of people. It's also a good idea to think about how you're doing laundry. If somebody is symptomatic, you want to use gloves and just make sure that when you wash that laundry, you're not putting it too close to you, and just be careful about where you're putting that before you get it in the wash. Definitely going to be watching for those emergency signs. Shortness of breath, blueness to their face or lips, sudden confusion, or persistent pain in their chest or pressure in their chest. You want to seek emergency care. And if there's symptoms you're not quite sure about and you're just concerned, you can always call the clinic and tell them what you're seeing. There is no treatment for COVID-19 at this time. It's important to drink lots of fluids and lots of water and get rest. If your symptoms worsen and you need to seek medical care, you can call ahead to let them know that you're coming in. For more information about COVID-19, you can go to the Minnesota Department of Health's website at the address on your screen, or call their COVID-19 hotline number. You can also visit the state of Minnesota's website at the following address.